Let's talk about the future of medical coding. One of the common questions I get is what medical coding specialties are not only in demand now, but will still be in demand in 5 to 10 years from now. So today I'm going to walk you through some of the future-proof specialties in medical coding, what areas are in demand, what are growing, what skills you're going to need to learn them, and how to position yourself for long-term success. So these are specialties that are going to keep you valuable into the future. And today's video is sponsored by the Advanced Specialty Coding Virtual Summits. Hey coders, if you want to stay on top of all of the 2026 updates, you need to check out the Advanced Specialty Coding Virtual Summits that are happening November and December of this year. These are not just like random trainings. You're going to hear directly from industry experts who break down all of the latest revisions, the very tested strategies, and the new policies that are going to impact your day-to-day coding. Choose the summit that best fits your personal coding specialty, which includes anesthesia, orthopedics, pain management, and even things like billing and compliance. And the best part, there's no travel cost. You don't have to take your vacation days. Each summit is 3 half days from 11 a.m. to 2:30 p.m. Eastern Standard Time, and you can join right from your desk. You also get live Q&A with the speakers, CEUs for as little as 38 per unit, and 60-day access to the recordings if you cannot make it live. Plus, when you register for one summit, you can add any additional summit for just $100. Registration does close the day of the event, but do not wait. Use code CONTEMPO to save 10% on registration and grab your spot now at decisionhealth.com/2025 summits. I'll also drop the link in the video description. Now let's go back to future-proof medical coding specialties. What do I mean when I say something is future-proof? That means we are going to continue to have services in that area because the patient population is growing or it's aging like the baby boomers. The services are complex, meaning that they require nuanced attention or the reimbursement is very high. This is a high-stakes area. Insurers are going to be scrutinizing these areas very, very heavily. Or it could be one where the specialty involves conditions that require a lot of documentation and compliance and auditing that is absolutely critical. So really honing in on areas where coders aren't just like data entry clerks. They are really getting down and doing a lot more analytical work. So let's break it down. First, I'm going to suggest risk adjustment, or what we call sometimes HCC coding. This involves a lot of Medicare Advantage plans, and the Medicare Advantage enrollment is skyrocketing. Every single year, more patients are opting to replace their standard Medicare plan with a Medicare Advantage replacement plan. So these coders have to be very skilled in chronic conditions and really understanding how these conditions are managed and treats. They have to understand status codes. They have to understand a little bit of what we call RAF scores, risk adjustment factor scores. So that is in very, very high demand. And the RADV audits are intensifying, just like I talked about in one of my recent videos about how we are seeing these very intense RADV audits. The compliance, the accuracy is much more important than it ever has been before. And the algorithms that are being implemented by these insurance companies are proving time and time again that they are falsely inflating numbers, and it takes a lot of human review to find out exactly how much damage they're doing. The second specialty that I would recommend is interventional radiology and cardiology. They are very incredibly complex areas, and the procedures are constantly evolving. They really require an advanced understanding of some clinical aspects of things, of the anatomy knowledge, and they are very highly reimbursed specialties. So payers tend to audit them more aggressively, which means that we need more skilled coders in this area. And again, not just working on the provider end, but when I say payers are auditing them, the payers need coders to do the auditing as well. The third specialty I'll say is oncology and hematology coding, because that is huge. Cancer care is growing, and it involves a lot of different concepts: chemotherapy, radiation therapy, infusion, and a lot of different drugs, and even new and evolving drugs, and how to navigate around the new technology concepts and the new drug concepts. So there's a lot more complexity with even things like HCPCS level 2 billing, with bundling, with things like medical necessity and frequency limitations. Plus, a lot of these patients have multiple comorbidities, which means coders are playing a huge role in accurate and reimbursement, not just for that specialty, but then also that tying into other factors we talked about, the risk adjustment factors, the HCC codes as well, the diagnosis-based reimbursement for the Medicare Advantage and all of that. And not to mention, experience in this area could be pretty great if you want to have some familiarity in that specialty, because you might be interested in transferring over to tumor registry. Fourth is behavioral health and psychiatry. Mental health has exploded, especially since the pandemic. And not only just the behavioral health, but telehealth access is expanding, and coders need to understand the different E&M and therapy codes and compliance rules that we have, because a lot more patients are more willing or consuming more behavioral health and psychiatry through telehealth. Even CMS and our commercial payers are putting more emphasis on mental health parity. So coders in the specialty are going to stay busy, assuming that people can actually get coverage and access to mental health care. Next, I would say, is orthopedics and anything kind of musculoskeletal related, like maybe even sports therapy. Patients are living longer. We're seeing a ton more things like joint replacements, fracture cares in our aging populations, especially as osteoporosis is a problem, and a lot more sports injuries, because as we're staying more active and trying to stay healthier, we are more active in some of those physical passions that we've had for a longer period of time, which tends to lead to potentially more injuries. And a lot of this coding involves global periods. It involves surgical modifiers. There's tons of documentation pitfalls, but not that there isn't with everything else, but this one especially. So coders who have mastered this specialty will always be valuable. And then last, just kind of in generality, compliance and auditing, which isn't really a specialty like in the same way that orthopedics is a specialty, but compliance coders and auditors are always going to be needed. With these AI tools that we have that are expediting medical coding, that are suggesting codes, humans are still needed to validate accuracy, especially in high dollar procedures, or especially where there is any sort of legal risk. So kind of think of auditors as the coders that are future-proofing themselves by moving into more of an oversight role. There's also a couple of emerging areas that might not be a bad one to look into for the future, but might not be quite as common yet, but they're definitely growing. Things like telehealth and remote patient monitoring. So we have a lot of new codes and policies that are constantly being added. So coders who kind of stay on top of that will be more valuable. Also, genomic testing and precision medicine lab and molecular testing codes are multiplying, or infusion and specialty pharmacy services, because we've got a lot of new biologics, advanced therapies. So there's some value in having advanced knowledge of that HCPCS level 2 type of coding. So now that you know what's in demand, how do you get into these specialties? Well, first, we should probably start with our base credential, the CPC. That's the good one that's going to give us that foundation so that, maybe we want to get into orthopedics, but we have to start somewhere else first. So we can start somewhere else and then move towards that goalpost of getting into orthopedics or getting into risk adjustment. And risk adjustment of specialty is a good one where you can get a nice certification in that. Look for those specialty certifications like the CRC through the AAPC for risk adjustment, or the CIRCC is a good one if you want to learn interventional radiology, or the COC if you want to learn facility-based outpatient coding. And like I always recommend, get out there and network, join your local chapters, get into specialty groups on LinkedIn or Facebook, and learn from coders that are already in those spaces. There's lots of ways now that you can keep an eye out for great specialty training for free at local chapters. And keep learning, because a lot of specialties are changing rapidly. You want to make CEUs your friend. And volunteer to cross-train. That's a great thing that employers like to see, that initiative in their coders, that maybe they want to cross-train so that someone else can go on vacation and they can cover their cases a little bit for them. I know sometimes the fear mongering online is overwhelming, especially when they're talking about things like AI and medical coding and outsourcing and offshoring and audit crackdowns and money paybacks. But honestly, the truth is that coders who really build their skills and are willing to learn the more complex, high stakes specialties are always going to be in demand. The healthcare system needs you. So whether it's risk adjustment or cardiology or interventional radiology or sports medicine or behavioral health, pick a path that interests you and really invest your time and your skills into it. And know that you are future-proofing your career with those time investments. And definitely let me know in the comments what specialty you are looking forward to working in or that you work in now that you really, really like. Or don't gatekeep. If you're working in a specialty that you really, really love and is paying you really well, let us know. We want to know this information. So if this video is helpful, don't forget to like, share, and subscribe. I will see you guys in the next video. And until then, just keep on coding on.